Okay, we're going to now visit the topic of when to call to tell us that you're in labor. And we do ask that you place a phone call if you're planning on going to the hospital. Again, if you don't get us and you really feel you're in labor, go to the hospital. There are four things to consider when determining whether it's time to go to the hospital. The first is movement. We want you to be aware that your baby is moving. You've all become accustomed to what your baby is doing, and everybody is different. But if you notice a change and you notice that you haven't felt movement for a period of time, then you should lay on your left side, put your hand on your stomach, have something sweet to eat or drink, and wait. If it doesn't happen within a half hour or at most an hour, you should call. If you begin having contractions, those are labor pains that will gradually change your cervix. Now, you are going to have contractions well before you go into labor. Those are called Braxton Hicks contractions. And what distinguishes a Braxton Hicks contraction from labor is the predictability of those contractions. In other words, if you're having contractions that are occurring every 3 minutes for a few, and then you don't get another one for 20 minutes, and then not for an hour, and then you get three, more than likely that's just irregular contractions. You probably should try drinking some fluids and see if they go away. But if the contractions are timeable and they're occurring every 5 to 7 minutes, they're lasting over an hour, and each one lasts maybe 45 seconds to a minute, and it's hard to talk through them because they're that painful, that's when you should call. If you have more than just spotting, if you have heavy vaginal bleeding, you should call. You all know the difference between spotting, which is going to happen as your cervix starts to change, and heavy vaginal bleeding, which could be a sign that something isn't right. If you have a question about it, call. And finally, if you break your bag of water, whether or not you have contractions or not, you need to call and let us know. Now, that's sometimes a little bit difficult to interpret. Usually we'll ask you, did you have a gush of fluid? Is it trickling down your leg? If you've broken your bag of water, it's not going to stop. So you can take maybe 10 to 15 minutes to try to determine whether or not you really broke your bag of water or you didn't. But if you have a question, you need to call, and more than likely, we either need to have you come into the office or we need to send you to the hospital for evaluation. It's very important that if you did break your bag of water, that we do have you in the hospital. So please don't be upset if we have to send you to the hospital only to find out that, guess what, it was a false alarm. That's common. It's not your fault. It's not our fault. It's just the consequence of having a baby. So I think that's enough for this topic. If you have questions that we didn't cover, please bring them up with your doctor at one of your visits.